11 alarming signs your body needs more zinc. Zinc, an essential trace mineral, is critical for numerous biochemical processes and functions in the human body. It plays a role in the cell division process, the healing of wounds, the synthesis of DNA, and the immune system. Additionally, zinc is necessary for the development of a healthy sense of smell and taste, as well as for the development of the brain during pregnancy. Despite its importance, zinc deficiency is a common issue globally, affecting around 2 billion people in developing regions. Nevertheless, due to the nuanced nature of its symptoms, this lack of this essential component in diet is frequently disregarded. Early detection of low-level zinc symptoms reduces the risk of serious health issues like memory loss, persistent diarrhea, and slowed growth. In today's video, we will discuss the 11 warning signs that indicate your body is lacking zinc. Always consult your primary care physician or a dietitian before making any diet changes, especially if you are experiencing symptoms that may indicate zinc deficiency. Let's get started. 1. Impaired immune function. Having a robust immune system is comparable to having the most effective lifeline. Zinc deficiency, on the other hand, has a significant impact on the immune system, which may make it more difficult for us to live a healthy lifestyle. Various transporters and regulators tightly control the availability of zinc, which is essential for modulating immune responses. When its homeostasis is disrupted, it affects the survival, proliferation, and differentiation of cells in different organs and systems, particularly those of the immune system. In addition, a zinc deficiency affects cells involved in both innate and adaptive immunity. Monocytes, polymorphonuclear cells, natural killer cells, T cells, and B cells are all examples of these types of cells, respectively. In contrast, a chronic reduction of zinc leads to an increase in inflammation and the production of pro-inflammatory cytokines. This change may influence the outcome of various inflammatory diseases, including rheumatoid arthritis. As for mitigating zinc deficiency through diet, adults aged 19 and above should consume 11 milligrams of this mineral per day for men and 8 milligrams for women, with the tolerable upper intake level set at 40 milligrams daily. Keep in mind that increased demand for essential minerals occurs in multiple settings, one of which is during pregnancy and lactation. Zinc requirements increase up to 2 times during these times, and up to 2 milligrams per day of loss occur, lasting up to 2 months postpartum. 2. Wound healing problems. When a wound does not heal fast, people generally suspect having higher blood sugar. However, a significant number of individuals are not aware of the fact that zinc deficiency is also strongly linked with reduced wound healing. This element is an important part of matrix metalloproteinases, which are needed for wound healing because they help remove dead skin cells and allow skin cells to move around. Apart from that, zinc provides resistance against epithelial apoptosis, protecting skin cells from reactive oxygen species and bacterial toxins. This role in protecting cells may be partly due to the antioxidant activity of metallothioneins that are high in cysteine and need zinc to work. Coagulation, inflammation, angiogenesis, the formation of new tissue, and the remodeling of the extracellular matrix are some of the various steps that are involved in the effective process of wound healing. Through its actions in reducing superinfections and promoting the epithelialization of wounds, this mineral appears to be more effective when applied topically, as seen in the use of zinc oxide paste bandages, for example. 3. Hair loss. Do you know that zinc deficiency may also cause hair loss? Zinc plays a crucial role in the synthesis of DNA and RNA, which is essential for the normal division of hair follicle cells. A shortage of it may disrupt this process, leading to increased hair shedding. Additionally, this mineral regulates androgens, which are a factor in androgenetic alopecia, also known as pattern hair loss. When there is a deficiency, it may exacerbate hair loss in individuals predisposed to this condition. Moreover, zinc is vital for protein synthesis and the formation of keratin, a key structural component of hair. A lack of it may result in weaker hair strands that are prone to breakage. Keratinocytes, the cells responsible for producing keratin, rely on zinc for their proliferation and differentiation. When the levels are low, keratin production may be compromised, affecting hair strength and integrity. In a study lasting 4 years, including around 310 individuals with different types of hair loss, zinc and copper levels in their blood were examined. The study found that people with hair loss had lower zinc levels compared to healthy individuals. The link between low zinc levels and hair loss was especially strong in those with alopecia areata and telogen effluvium. This suggests that you should probably look into your diet to monitor your mineral intake to deal with hair loss issues. 4. Skin issues. A healthy and supple skin is everyone's dream. Nevertheless, even a zinc deficiency may have a detrimental effect on the visible appearance of your skin. This trace mineral is essential for maintaining the integrity of the skin barrier, as it is involved in the synthesis of collagen, a vital component of the skin's structural support. A deficiency in zinc may result in increased susceptibility to skin infections. You may already be aware that zinc acts as an antioxidant to shield skin cells from oxidative damage. This oxidative stress may contribute to aging and various skin diseases. Aside from that, it regulates sebum production in the skin. An imbalance in sebum production may lead to conditions like acne or seborrheic dermatitis. With mild to moderate acne, zinc sulfate applied topically at a concentration of 5% was effective. In addition to that, after 3 months of oral treatment at doses of 100 mg 3 times a day, it was found to be effective in treating rosacea. Clinical improvement was observed when zinc gluconate was taken orally at a dosage of 90 mg per day. 5. Diarrhea. There might be various reasons to get diarrhea. However, you should never completely rule out the possibility of having a zinc deficiency. This mineral is crucial for maintaining the integrity of the intestinal mucosa, which acts as a barrier against pathogens and regulates nutrient absorption. Its deficiency may weaken this barrier, making it more permeable and susceptible to infections and inflammation. This increased permeability may allow pathogens and toxins to enter the bloodstream more easily, potentially leading to diarrhea. Zinc is a cofactor for many enzymes involved in digestion and metabolism. It, for example, plays a significant role in the activity of enzymes that are responsible for the breakdown of proteins and carbohydrates. A lack of zinc may disrupt these processes, leading to improper digestion and absorption of nutrients, which may contribute to diarrhea. In a study with about 940 children aged 6 to 35 months in New Delhi, India, 20 milligrams of daily zinc supplementation alongside oral rehydration and vitamins led to a 23% reduction in ongoing diarrhea. Notably, there was a 38% decrease in diarrhea risk after the 3rd day of the treatment. The study found that early zinc supplementation significantly reduced the duration and severity of acute diarrhea, especially in children with stunted growth. 6. Mood disorders. Certainly, one's mood may change quite a bit depending on the circumstances. However, have you ever considered the possibility that inadequate nutrition could also be a contributing factor? Zinc is involved in neuroplasticity, the brain's ability to adapt and change in response to experience. It influences processes like synaptic plasticity, which is crucial for learning and memory. That's how zinc deficiency may impair these processes, leading to cognitive changes that are often associated with mood disorders. In addition to that, zinc influences the HPA axis, a central part of the body's stress response system. Dysregulation of the HPA axis is implicated in various mood disorders. When our bodies lack zinc, it disrupts the HPA axis, leading to altered stress responses and mood regulation. You may keep living in a good mood by just incorporating foods rich in zinc, including meats, poultry, seafood, especially shellfish like oysters, crab and lobster, legumes, nuts, seeds, whole grains, and fortified breakfast cereals. It's important to note that plant sources like legumes and whole grains contain phytates, which may bind to zinc and lower its absorption. 7. Cognitive function impairment. Memories are our gateway to the world, but when our thoughts and memories become weak, it may impair our lifestyle as well. Zinc plays a pivotal role in the regulation of neurotransmitters, the chemical messengers of the brain. It modulates the action of glutamate and GABA, the primary excitatory and inhibitory neurotransmitters in the central nervous system, respectively. Zinc deficiency may disrupt this balance, leading to altered neuronal excitability and impaired cognitive function. Moreover, zinc is essential for brain development and the process of neurogenesis, the production of new neurons throughout life. When a baby suffers from zinc deficiency during critical periods of brain development, it may lead to altered brain structure and function, affecting cognitive abilities. During pregnancy and lactation, a low zinc intake by the mother has been linked to decreased attention focus in neonates as well as decreased motor function in 6-month-old babies, according to studies. Infants who were born with a low birth weight benefited from zinc supplementation, which led to improved motor development and increased playfulness. When it came to infants and toddlers, it led to activity that was both more vigorous and more functional. Zinc supplementation may be able to improve neuropsychological functions in older children who are attending school as well. 8. Decreased sense of taste and smell. Many of us have experienced how to live in a world without smell and taste during COVID times. But it may also happen if you don't monitor your zinc intake. It is essential for the proper function of gustatory taste cells. It's involved in the synthesis and activity of gustin, a protein that regulates the growth and development of taste buds on the tongue. Deficiency of this element may lead to the atrophy of taste buds, reducing their sensitivity and number, which diminishes the sense of taste, a condition known as hypogeusia. Zinc plays a significant role in the olfactory system, sense of smell. It's required for the synthesis of enzymes and proteins, essential for olfactory cell function. Its deficiency may impair the regeneration of olfactory receptor cells and affect signal transduction pathways in the olfactory system, leading to a reduced sense of smell, known as hyposmia. A meta-analysis involving 12 randomized controlled trials with about 940 subjects found that zinc supplementation effectively treated taste disorders. The study used various dosages equivalent to 17 milligrams to 87 milligrams of elemental zinc for 3 to 6 months. The results showed significant improvements in patients with chronic renal disease. High doses of zinc, ranging from 68 to 87 milligrams every day, were found to be effective for up to 6 months. 9. Reproductive health issues. Zinc plays a vital role in the production and regulation of key reproductive hormones, such as testosterone in men and estrogen and progesterone in women. A deficiency may lead to hormonal imbalances affecting fertility and sexual development. In men, low zinc levels may result in reduced testosterone production, potentially leading to hypogonadism, decreased libido, and infertility. Aside from that, in women, zinc is important for the growth and development of the oocyte egg cell and early embryonic development. Its deficiency during pregnancy may lead to complications such as miscarriage, low birth weight, and congenital abnormalities. A study conducted in 2018 found that zinc therapy improves the quality of sperm by increasing sperm density, promoting progressive motility, and enhancing the likelihood of conception and the outcome of pregnancy. 10. Vision problems. With so much screen time, people tend to have some vision problems, more or less. However, zinc deficiency may make it worse. It is involved in the metabolism of vitamin A, an essential nutrient for vision. It helps transport vitamin A from the liver to the retina, where it's converted into retinol, a molecule necessary for the synthesis of visual pigments. These pigments, located in the photoreceptor cells, are critical for light detection and vision. Zinc deficiency may impair this process, leading to a decrease in visual pigment production, which may result in night blindness and other visual impairments. The age-related eye disease study, which included around 3,600 participants between the ages of 55 and 80, discovered that a combination of antioxidants and zinc significantly slowed the progression of age-related macular degeneration and the loss of visual acuity. It appears that those who are at risk of developing advanced AMD may benefit from taking supplements that contain zinc and antioxidants. 11. Persistent fatigue and weakness. A lack of energy is a common sign of many diseases and nutritional deficiencies. Because of this, many people frequently overlook it. However, zinc is a key component in various enzymes responsible for energy metabolism. It plays a crucial role in the conversion of food into energy. Thus, when we don't get enough zinc, it may impair these metabolic processes, leading to decreased energy production and increased fatigue. Moreover, zinc is essential for protein synthesis and cell growth, which are vital for maintaining muscle health. A weak muscle tends to get tired more easily. Apart from these, you may also be aware that zinc plays a role in regulating hormones, including thyroid hormones. They are essential for regulating metabolism and energy levels. Thus, a drop in its level may disrupt thyroid function, leading to hypothyroidism, a condition often associated with fatigue. Each of these 11 signs underscores the multifaceted role zinc plays in the human body and the wide-ranging impacts of its deficiency. If you suspect a deficiency, a consultation with a healthcare provider and a balanced diet are key steps towards optimal health. Remember, while these signs may indicate a deficiency, they may also be linked to other health issues. It is strongly recommended that a consultation with a qualified medical professional take place prior to making any changes to your diet, supplement routine, or seeking medical attention for any of the symptoms that are described in this video. Even though zinc deficiency is relatively common, the condition may have serious repercussions if it is not treated. Now that we have learned about the signs of zinc deficiency, let's discuss another topic that may be of interest. Did you know certain drinks may greatly benefit your health? Wondering what they are? Watch. Drink clove tea every day for 1 week. See what happens to your body. Or watch. The longest living people drink this every day. Go ahead. Watch one, or even better, watch both. Will you be more cautious about your zinc intake. Let us know in the comments below.